Alright, so now we're going to go over the vessels of the trunk and the upper limbs. We're going to start with this one, which we looked at last time, the vertebral artery. You see that it comes off this right subclavian right here, going up. And that's going to go up through those cervical transverse foramen again. Moving over to the axillary, so you have the brachiocephalic come up, subclavian, and then when it gets around the armpit region, or our axillary region, it is called the axillary artery. That's why we learn those early on terms, because they just keep popping up. So around the armpit, it is the axillary artery. And then there's a branch off the axillary artery that comes back to the scapula, and that's called the subscapular artery, going to that anterior part of the scapula, to that subscapular muscle. And then we come down to the brachial artery. So after the subscapular comes off the axillary, we get your brachial artery. And this one is a pulse point, so you can put your fingers right about here at that antecubital area, and you can feel a pulse. You can also feel it up higher on the biceps. This is the artery that people check for your blood pressure. So you constrict this brachial artery when you're taking somebody's blood pressure, and whenever the pressure in the cuff matches the top, the systolic pressure, you'll actually hear some blood flow starting. The first sound of carrot cough, or core cough, however you want to say it. And then when you don't hear any more of that laminate flow, that is your diastolic. But stuff you learn in physiology. Alright. Our next one is way down here on the lateral side. So your brachial comes and will split, and you'll get your radial and your ulnar. Your radial artery is another pulse point. If you feel down, thumb side, a little bit below your wrist, you should be able to feel a pulse there. And then we have our ulnar artery on that medial side. Coming over here, you can see your descending aorta. So you have this aortic arch up here, and then it comes down, and after the arch, this is all descending aorta. And this descending aorta travels basically all the way through your trunk until it splits into your left and right common iliac artery. Next one is your brachiocephalic trunk. So this first branch off of the aortic arch is your brachiocephalic trunk. Break those two words down. What does that mean? Brachio is talking about the arm, and cephalic is talking about the head. And so this trunk actually sends blood to the arm and the head. Then we have our left subclavian. Your left subclavian branches off after your left common carotid, and then you have your left subclavian. Subclavian, what does that refer to? Well, it's going to be below the clavicle. And so you know where your subclavian is. Here you can see it running right underneath that clavicle. So if it is below the clavicle, that is your subclavian artery. Here you can see your right subclavian. After that, so you have your brachiocephalic right here, but after the right common carotid branches off, now it's no longer called the brachiocephalic because it's no longer going to the head. That one's already branched off. Instead, it is below the clavicle, and so it becomes your right subclavian. And then up here, you can see your common carotid arteries, left and right. That is another pulse point. So that's the one when you're checking your pulse on your neck, you're checking your common carotid arteries. So this is basically just like a big road that starts to split off, and as these roads split off of another road, they just get a new name. And you can remember off of this aortic arch, the first 3 splits are going to be your ABCs. So the first one is your aorta, your aortic arch, that's your A. Your B is going to be your brachiocephalic, that is going to go into your right common carotid in your right subclavian. Your C is your left common carotid, and then your S is going to be your left subclavian. There's a lot of variation or anomalies in this branching, so it's not always like this. Sometimes you'll have 4 branches right here, and it'll be right subclavian, right common carotid, left common carotid, left subclavian. Or sometimes this brachiocephalic will take in this other carotid, and so it would be a brachiocephalic, and then both carotids branch off, and then your subclavian. And there's lots of variety to this. Sometimes there's another artery called the vertebral, and you'll have your vertebral here in between your left subclavian and common carotid, and there's just a lot of variations that can happen in this. This is the most common, and so this is the one that we're learning. So we move over to the veins. Looking at your veins, this last vein before it enters the heart is going to be your superior vena cava. The superior vena cava is draining all the blood from the upper limbs and the head. And then your inferior down here will be doing the lower part of the body. You have your internal thoracic, which is one of the first branches off, or one of the last branches to the superior vena cava. You can see it's draining the blood from your thoracic cage on the anterior and dumps it in there, where the azygos coming up from the posterior does the same thing and delivers blood to the superior vena cava. And then down here we also have your hepatic vein. Your hepatic vein is going to be going to the liver or from the liver. So the liver is filled with nutrients, and the hepatic vein can take the blood from the liver filled with those nutrients and then deliver it to the body. So normally when you think of veins, you probably think of like, oh, it's waste material. It's filled with carbon dioxide and you have to get rid of it. But really, a lot of your veins also have a lot of nutrients in it, because it is taking the blood away from the intestines, which is loaded with nutrients, taking that blood to the liver or from the liver, and then delivering all that out. So this hepatic vein is really important in your overall nutritional status. And then coming down here, renal veins. These are the veins coming from the kidneys. So they have just delivered a lot of nitrogenous waste to the kidneys to be removed. And so this blood is freshly cleaned, coming back to the inferior vena cava to be delivered to the heart. Your gonadal. This one depends on if you're male or female. In this version, it is neither, and so you can just call it the gonadal. But if it was a female, it would be the ovarian. If it was a male, it'd be the testicular vein going to the gonads. And then down here, going on the posterior wall, is going to be your lumbar veins, going out where you have your lumbar vertebrae, because you can see the ribs stop here, so those are all in the thoracic. So down here is your lumbar. And then over here, on this one, it shows it branching off the renal to go up to the adrenal. And so up here, you have your adrenal glands that produce adrenaline, epinephrine, norepinephrine. And so on this one, you can see it coming up from the renal, but over here it branches off, or branches to the inferior vena cava. So this one doesn't follow the same path as the other one. You can see your kidneys are at different heights, which is pretty normal. Basically, if it is coming from the adrenal glands, it is the adrenal vein. And then again, there's your inferior vena cava right here, this big one in the middle. Over here, so you have your brachiocephalics draining into your superior vena cava. Here's your subclavian after the jugulars drain in here. But before that, you're going to have a branch that goes to the axillary and one that wraps over the top, called the cephalic. Don't know why this one's called the cephalic, because it's not going to the head, it's coming from the arm, but that's what it's called. And then again, here you can see your axillary about the armpit area. When those two come together, you get your subclavian. When the vertebral and the jugulars drain in, then you get your brachiocephalic. Again, if it's below the clavicle, before you get that, or after you get your axillary and cephalic coming in, it is subclavian. But only before you get your jugulars and vertebrals, because then it becomes brachiocephalic. You'll notice that unlike the arteries where you have a common carotid, you don't have a common jugular. You have an external and an internal. They're two separate vessels. And in between them is the vertebral. So you have external coming up the outside, vertebral branches off to go up through the cervical foramen, transverse foramen, and then your internal jugular coming up on the inside. Popping out over here to the arms again, you can see your subclavian coming out under that clavicle. Axillary after it comes out from the clavicle around the armpit region and splitting into your axillary and your cephalic. Off the axillary, you're going to have your brachial and then your basilic. And off of that basilic, you can get your median cubital, which is one that is typically punctured on blood draws. And then coming down off the brachial, you'll get your radial and your ulnar. So, where will you find a vessel named subclavian? Hope you all said under the clavicle, because I've said it like 6 times today. What is the difference between the jugulars and the carotids? Well, the jugulars don't have a common jugular. Instead, you have just external and internal, where the carotids have a common and then your externals and internals. The vessels that go to or from the kidneys are called renal vessels. And that's all we're going to cover in this one, and we will pick up with the leg vessels in the lower limbs next time.